So, how do we improve health literacy? Well, the definition of health literacy is actually the answer to improving it. It is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make the appropriate health decisions. So basically, it is giving the client the opportunity through education. The most important things to remember about health literacy is to make sure your client obtains the information, processes the information, and understands the information. These things must occur. So if you have to create a presentation or a flyer or a handout that is not as technical and is in basic terms, that is key. If they don't understand the information and they have the information, it's doing them no good. Again, health literacy is not just about reading along. Most of our parents and patients read between a 6th and 8th grade reading level, but that always doesn't really make a whole lot of difference because many of these individuals might not be able to read in their native tongue, and they definitely can't read English. So it is best to use pictures and diagrams, and if at all possible, try to put things in as basic of language and understanding as possible. You can always make it more technical, but it's hard to make it simple. So I'm not sure if you can see this really well, but this is the Health Literacy Universal Protections Toolkit. So basically, it is an electronic version of what the physician and or doctor will need. It has websites to like medication reconciliation, improving patient care website, and this toolkit, is based from a hospital, so it's their own kind of intranet that they're using. And this is actually where we need to actually be as a nation. We need to know that all of the information we're capturing, everyone else does all around the United States. It makes things very easy. Again, materials written, plain language, what is that? Just simple. No one technique defines plain language, but the basis for plain language is just making sure they understand the need and making sure they know what they need to do as it pertains to their health. So, where does this data come from? Health literacy, making things plain. Well, this comes from the provider documentation. This comes from all of the nurses and doctors and administrative staff and medical check-in and central registration, because they're the individuals that see the patients first and see firsthand what they can and cannot do and what they struggle with and how we need to improve that access to healthcare. In some services. They have what you call group learning, educational assessments. So some of us will read, some of us will be in small groups, some of us will talk to the patient or family, and some of us will show videos. This all depends on who you're dealing with as a patient, and your clinical staff and administrative staff will need to embrace that and figure out just exactly what needs to happen. This is all very individual. You can't just make it standard for everyone. And another big factor is confidence. Confidence is used to assess the likeliness that the patient will take an active role in managing their health and well-being. It is very interesting. If people don't have confidence in themselves, they definitely don't have confidence about their health. Especially if they have diabetes or something along those lines. If you're finding that that person is having difficulty struggling with managing this disease, there are probably other issues that need to be addressed, and one of them might be the need for navigation and the need to really take the patient by the hand and ask them questions about how comfortable they are receiving the information and why it's difficult. So, patient education encompasses many aspects of care. You have outcomes, explain, discuss, family, protocol, standards, importance. All of these are very important when it comes to patient care and education. Just to summarize, the level of understanding is very important. One of the problems has always been with health literacy is that many patients with low literacy may also have low levels of confidence. In fact, some patients may not be able to read at all. Be sure to verify that in a confidential and private manner so that you don't embarrass your patient. If you have any questions, my email was at the beginning of the presentation. I thank you for listening today.